coding. So panel coding means two panels done in that higher panel CPT first. In smallest panel, whatever test present, everything is coming in the higher means no need to code smallest panel separately. Code only higher. But one test present in the smallest that is not in the higher, code that CPT alone additionally. Correct. That is the concept. So that is the panel codes. Please remember. Now I'm going to give the answers for panel coding first. Okay. So here I'm giving the answers. Okay. So please select the answers. Please cross check. Please cross check my answers for panel coding. In there any doubt you have now, you can ask me. I will explain. Okay. CMP with electrolyte panel. So everyone is clear, right? So electrolyte panel all inclusive in the CMP, so that only 80053. Renal functional panel 84100 alone missing in the higher. So that 80053 and 84100. Then lipid panel 80053. Lipid panel below 3 tests present. All are missing. So that panel itself we have to code separately. 80053 and 80061. Then hepatic functional 82242, 82248 missing in the higher. So 80053, 82248. Then OB panel including HIV testing. So OB panel including HIV testing code is 80081 and CMP panel code is 80053. So both panel have to code separately. Then last one electrolyte panel. Electrolyte panel full included in the DMP calcium total. So 80048 alone. Everyone clear, right? Okay. So next, I'm giving for that surgical pathology sample taking, right? Sample taken from the which level? Cross or microscopic mean that sample name, surgery name, site name basis. You need to select. Okay, CMP with OB panel, both are different panels, right? So you can code both panels separately. That only I given. That's why I given the AW081 and AW053. What is the doubt in that? So why I given AW081 is first mean that is compared to the CMP have the more test, because in that one test is there na CBC. So CBC itself it will come the near 7 to 8 test. CBC itself in that OB panel we have CBC complete blood count. So that alone it will come near 7 to 8 test. Then that is 7 to 8 and your hepatitis 9, 10, 11, 12, 13, 14, 15. Compared to that, it is, we are getting more tests. So that only I given A0081 first, then A0053. You clear now? Okay, next I'm giving the surgical pathology. That question answers I'm giving. Please cross check everyone. Guys, any doubt?
Hello.
Yeah, yeah.
Sir, sample taken from appendix gross and microscopic exam. When we have to code that appendix other than incidental 8830.
Okay. In
Uh,
your question,
88302.
incidental.
Uh,
In your question, incidental mention incidental.
okay, okay.
Otherwise, other than incidental.
Okay. Thank you, sir.
Incidental mention word is there, you can go incidental. Otherwise, you can go for the other than incidental.
Okay. Thank you, sir.
Yeah. Bicuspid valve is the heart valve. Skin ulcer other than cyst tag debridement. Skin ulcer, you need to take for the other than cyst tag debridement. Okay. Then lymph node direct, then uterus for prolapse, uterus without prolapse, uterus for neoplasm. It is all direct one only. But the term correctly you have to look. Uterus for prolapse, uterus without prolapse, neoplasm, finger amputation, testis TRP, and testis tumor. Okay, from this 10, you will get one question you will get. Skin ulcer you have to take for the other than cyst tag debridement. Okay, everyone clear? And also I given some other questions, right? You need to take from the back side. Therapeutic drug assay, dejox, chromosome analysis. That answers I need. We are asking question for 5 and 6. Okay, I will show that 1 second. Uterus sample taken from the uterus for prolapse. Okay. So uterus for prolapse. You are looking at the page number 689. In that, uterus with or without tubes and ovaries for prolapse. So I said uterus for prolapse. So uterus for prolapse means then your code is 88305. 88305. Uterus for prolapse. Everyone clear? Then sixth one is for the uterus other than prolapse. That means without prolapse. So uterus for with or without tubes and ovaries only without. But other than prolapse or neoplasm. That means uterus without prolapse. So 88307. Then uterus for neoplasm 88309. Okay, I think you clear. Other last 6 question. Everyone give the answer. Chromosome analysis, therapeutic drug assay, sputum culture. Please give the answer once. Okay, please cross check everyone. Please cross check my answers first. Then you have doubt when you can ask me. Guys, please cross check my answers. In this answer, you have doubt, mean you can ask. So digoxin, therapy drug as a under digoxin you are searching 80162. Doxepin 80335. Chromosome analysis for 20 cells with 2 karyotypes with banding W262. Chromosome analysis for 20 cells with 3 karyotypes, then W262 for 2 karyotypes with banding, then 1 karyotype extra we have W280. And tissue culture for non-neoplastic disorder, for that W230 and chromosome analysis W262. The last one, sputum culture fungus other than blood source 87102. Fourth one, what doubt? You can go back side of the book, chromosome analysis under cryonic villus. You will get the code W262. If it is 20 cells, 2 karyotypes mean. But one karyotype alone we are extra, so you have to give the karyotype additional code. So W280. Karyotypes additionally need to code. Okay. So this is the things you have to know. Next, moving for that, evocation and suppression testing. Next topic, evocative and suppression testing. Yeah, page number 609. Everyone take the page number 609. Header we have evocative and suppression testing. Evocative, suppression testing. First 3 lines, please write everyone. Following test panels involves the administration of evocative suppressive agents and the baseline and subsequent measurements of their effects on clinical constituents. Evocative and suppression testing. Please keep the header evocative suppression under first 4 lines. Up to constituents you can write. Please write everyone. So evocative, that endocrine glands secreting very less hormone. In that time, we need to stimulate the activity of the glands. In that time, they are injecting the evocative agents. So evocative agent injected into the gland, then they are checking how it is functioning. It's become normal or not. That is the evocative. Suppression means that gland secreting more hormone, overactivity. In that time, they will inject the suppressive agents into the gland. Then they will do testing how it is functioning. It's become normal or not. That is the suppress. So overactivity na suppress agents, less activity na. It is similar to the panel coding. Panel coding want to give that panel below what test, how many times present, like that met you can give panel. Suppose any 1 or 2 tests missing, don't give panel, code each separately. Correct. Same concept here also. But here quantity is also very important. Exact quantity number should met. Everyone please write the panel name, growth hormone suppression panel. Growth hormone suppression panel. Please write this panel name. Please write the panel name, growth hormone suppression panel. This panel want to code how many glucose you need, growth hormone you need. Everyone, this panel want to code how many glucose, how many growth hormone you need. Growth hormone suppression panel want to code that panel below what test? Glucose here 3 times mentioned. Then growth hormone 4 times mentioned. You like that? Name of this test and quantity is also very important. Then only can go with the panel code. Okay. Suppose growth hormone suppression panel mentioned in that they're telling glucose 2 times, growth hormone 4 times. Now what you will do? Growth hormone suppression panel in that glucose 2 times, growth hormone 4 times. What is your answer? So glucose 2 times, growth hormone 4 times. Glucose 2 times, growth hormone 4 times. Then that panel quantity is not met, correct? So in that time, don't give the panel, don't give the panel code each test separately how many times. So don't give panel code. So your answer 82947 into 2, 82947 into 2, then 83003 into 4. Because that panel is not met. You don't give the modifiers, 52 modifier and all not applicable in the panel coding. Okay, please aware of that. The panel met, panel code. Panel not met, code each is separately. Panel met, suppose extra is there. Panel met, extra is there. Example, growth hormone suppression panel. In that, glucose 5 times, growth hormone 5 times. Now what you will do? Panel met, panel code. Panel not met, code each is separately. Panel met, extra is there. Then what is your answer? Panel met, extra is there. Guys, don't give. Why you are going for other panel? I said any other panel name? I said growth hormone suppression panel only. I said. Why you are taking growth hormone deficiency? I said only growth hormone suppression panel. So that means panel met extra is there. Correct. So panel met extra is there now. First you have to give the panel code 80430. We are giving like that glucose 3 times, growth hormone 4 times, it's included. So remaining, how many glucose extra we have? How many glucose extra we have compared to that panel? How many tests extra? You have to give first panel code, then glucose 2 time extra. So 82947 into 2, growth hormone 1 time extra, 83003. Everyone clear? Panel made, panel code. Panel not made, code each is separately. Panel made extra is there. First you have to give the panel code. Then what test, how many time extra? You need to give like that. Okay, panel not met, panel code. Panel met extra is there. First panel code, then code each test separately. Panel not met, code each test separately how many times? Yes, yes. Ask your doubt. I'm not getting your doubt. That panel, yeah, one panel code you are giving, you are saying glucose three times, growth hormone 4 times. That is the meaning of the 80430 growth hormone suppression panel. That in that panel quantity is not met, don't give panel code. Code glucose separate, growth hormone separate. Suppose panel met extra is there, panel met quantity extra is there. First you have to give the panel code. Then what test, how many time extra you have to give separately. Okay. So like this way you need to report. So you can look the other panel names in that page number 8, sorry, 609, 610, 611. 609, 610, 611. These 3 pages you can look, you can select the answers. Other panel example I'm giving, please check correctly. Panel met, panel code. Panel not met, don't give panel. Panel met extra is there. First panel code, then code each is separately. Select the answer for this. Please give the answers.
Sir, one doubt, sir.
Yeah, tell me.
செகண்ட் கொஸ்டினுக்கு 80435 போக அடிஷ்னலா இன்னொரு பேனல் கூட ஆட் பண்ணலாமா சார் எக்ஸ்ட்ரா
No,
டெஸ்ட்டுக்கு?
don't give. You can give only quantity only can.
ஓ, ஒரு பேனல் கூட தான் கொடுத்து எக்ஸஸா
Yes.
இருக்கிறதுக்கு ஆட் ஆன் கோட் கொடுத்துக்கணும்.
Yeah.
செப்பரேட் டெஸ்ட். ஓகே ஓகே, தேங்க்யூ.
Guys, I said for the panel want to give that panel below what test, how many times that quantity they are giving, right? That quantity, the test name, everything exactly met na panel code. That quantity is not met, one or two quantities less na, don't give the panel code each test separately. If panel met, extra is there. Panel met, extra we have. First you have to give the panel code. Then what test? How many time extra? What test? How many time extra you need to give additionally. Panel not met, don't give panel. Panel met, panel code. Panel met extra is there. First panel code, then extra test separately. Guys, here I'm giving the answer. Growth hormone suppression panel, glucose 4 times, growth hormone 6 times means compared to panel extra is there. So first panel code 80430, then 1 time glucose extra, then 2 time growth hormone extra, like that. Okay, similarly other question also. Please cross check my answers. You have doubt mean you can ask me. Please cross check everyone, please. Guys, you cleared this? Everyone? So next, I'm moving for the drug testing. Drug testing we have. Drug testing, please write this. 2 lines, please write everyone. Okay, so while coming with the drug testing, you have to check for the it is presumptive or definitive. Presumptive drug testing or definitive. Presumptive means need to check the presence or absence, positive or negative, inside the sample, what present they are finding. That is for the presumptive. Once checking inside, how much volume, exact level, how much exact level present, that is for the definitive. So you need to check the positive or negative presence or absence is the presumptive. Then how much level, exact volume, that is for definitive. Okay. So okay, after consuming the alcohol, you are driving the car or bike. The time traffic police assumption maybe you consumed alcohol, they are stopping. While checking result, it will come for the assumption while checking. Maybe result it will come positive or negative. If you taken, it will come positive. Otherwise, it will come negative. So that is the presumptive. Okay, confirmed. You consumed the alcohol, confirmed. Then how much exact blood alcohol level? How much exact blood alcohol level? That is the definitive. So what presence need to find? It is presumptive. How much exact volume level? It is for definitive. Okay, so you need to know presumptive and definitive. Presumptive, we have the code. Three codes we have 80305, 306, 307. 80305, 306, 307. Page number 602. Please check the page number 602. There mentioned presumptive drug testing. Presumptive drug testing by direct optical observation. Presumptive drug testing by direct optical observation 80305. By instrument 80306. Chemistry analyzer method 307. Direct optical observation 305. By instrument 306. Chemistry analyzer method 307. So please check these three answers, sorry, these codes inside the book and take the short note of this. 305 is direct optical observation. 306 by instrument. 307 by chemistry analyzer method. Please make it note. Okay, so this is the presumptive. We have the codes. Direct optical observation by instrument, chemistry analyzer method. So one question they're asking in exam. Presumptive drug testing by chromatography. Presumptive drug testing by chromatography. What is the answer?
80306.
Very good. Presumptive drug testing by chromatography. Your answer is for 80307. 80307. So this is you can remember, it's very important. It's coming in exam. So next I'm going for definitive. So definitive you are turning the pages. We have page number 604. 604 in that definitive drug classes listing mentioned. So any drug I'm telling, you need to check for that drug comes under what class? Acetone, ethanol, ethylene glycol, isopropanol, isopropyl alcohol. Methanol mean what class it is falling? These all drugs fall under what class?
Alcohol, sir.
Alcohols. Yes, correct. Alcohols. So your code is 80320. While checking the drugs, it's falling what class, and here you have to check what code. So 80320, so I again selected this. Next one, ethanol conjugates, ethyl sulfate, fatty acid, ethyl esters. Ethanol conjugates, ethyl sulfate, fatty acid, ethyl esters. So what class? What is the code? What class? What is the code? Yes, it is for alcohol.
Markers.
Yes.
801 to 80322.
Now it is fall under alcohol biomarkers, but we have the code range only, not exact code. So code range given, you can go with the above pages. You have to confirm what is the exact code. 80321 is there. So 80321, page number 602. It is for alcohol biomarkers 1 or 2. 80322 is 3 or more. So in that one, I said three drugs. So 3 drugs mean what is the answer?
80322, sir.
Yes, correct. 80322 is the correct. So like that only you need to check. Okay. So like that you can try. I'm going to give some other drugs, other substance. You need to find the answer. Codeine, hydrocodone, hydromorphone, morphine, oxycodone, oxymorphone, and naloxone. Find the answer for these drugs.
Mm.
Okay, okay. So now I will tell the answer. So codeine, hydrocodone, hydromorphone, morphine is all OPH. Correct. So 80361. Then oxycodone, oxymorphone, oxycodone category. So 80365. Then third one, naloxone. It is for opioids and opiate analogs. So 80362. So everyone clear? So 80361, 80362, and 80365, 80362. Any doubts, guys? Sequencing not an issue here.